this point in our lives where people don't thank us much anymore, and that's okay. And in fact, they might say, "You're ending the epidemic. What the hell have you been doing these past 30 years?" And I said, "Dad, we're really trying." Um, so, and I also just wanted to show you, it's a very cool thing about this group and this meeting. Can you show them the sign, the stop sign? It says stop, and then it says please. It's really, so I feel very safe here. So thanks for creating that space. So there are a couple terms that I think are important that Steve alluded to and that I think are driving why we're here together today. And that's that we've made a concerted effort at the federal level to cooperate so much more, and it's been energizing, and relationships are built on trust. And I think because we've been working together now for 20 years, we have developed a trust. And maybe some of you have or have not worked together, maybe you haven't worked with researchers, but I promise you that we fund researchers that give a shit, and we fund researchers that do not get in the way, and we fund researchers that really are as passionate, and there's passionate people at the federal level that are really trying to do what we can to listen to you, because that's our job. And so I really want to hear the ideas about research that we can fund, because here's what I can offer. I'm at NIMH at the National Institute of Mental Health. We've been funding research for a long time that's been trying to be helpful in this fight, to try and reach some of the folks that Steve alluded to. Maybe that's a 15 to 20%, but that's a revolving door. So it's not the same 15 to 20% all the time. Life changes. And so we're making a concerted effort not to call them hard to reach anymore, but hardly reached. That's not their fault. It's our fault, but I try not to blame myself too much, that we're not doing the right things. It's just maybe there are some things that we can do differently. And so one of the things that we can do at NIH is put out calls for applications that answer the questions that you need answered. And we will do the best that we can to work as quickly as we can to move that glacier to answer those questions, but it requires perhaps some new collaborations and partnerships, and allowing people into our worlds and knowing what each other does. So how is it that research can help in this process? And there are people at CHIPTS and other centers around the country. We funded 65 supplements now to centers between NIMH and NIAID, and those are planting seeds to do these kinds of planning meetings to figure out in the next 6 months to a year, are there research applications that can be jointly submitted that can help you both enhance your services immediately, but also produce generalizable knowledge that you're the first regional response effort that I'm aware of that's happening, that's funded in this process. You could be a model for how to do this in other places so that there can be cross-county learnings, and the things that you learn here about the efforts that you make in surveillance and intervention can be a model for what can be done around the country. And so it really is an awesome opportunity, and I'm just happy to be a part of it. And more so than ever, what I'm hearing amongst my colleagues at HRSA and SAMHSA and NIH and IHS is that this process needs to be ground up and not top down. And so I think I'll just stop there and save time to do more listening. And thanks again for being here. And please, I think I get it, and we think we get it. But if I don't get it, tell me, and tell me what I need to do more of. So thanks.